Thank you for joining this episode of Rattling the Bars. Today, America is in a number of crises. There's the pandemic that's sweeping the world. There was an attempted takeover of the American government by right-wing elements. Small businesses are under the threat of bankruptcy. Millions of people have lost their jobs. Millions more are under the threat of losing their houses. And in the midst of all of this, there's a threat and terror behind the walls of the prison industrial complex that's going unnoticed. So joining me today to talk about what's happening in the prison industrial complex is Dr. Lauren Brinkley-Rubenstein. Dr. Brinkley-Rubenstein is an assistant professor of social medicine at the University of North Carolina, Chapel Hill, as well as a core faculty member in the University of North Carolina Center for Health Equity Research. She is also co-founder of the COVID Prison Project. Thank you for joining me, Dr. Lauren.
It's my pleasure. I'm excited to be here.
Okay, Lauren, can you talk a little bit about the COVID Prison Project that you co-founded, why you thought it was needed and what it does?
Sure. So in March, I've been studying and thinking about the impact of incarceration on health for a long time. In March, when it was clear that the pandemic was here and was going to affect American society, it really was clear to me that this was going to have a disproportionate impact on people who are incarcerated. And in this field, we're really used to not having much information about health conditions or what's even happening behind the bars. And we found that many systems across the country were giving us some information. And so we thought, this is a really important and critical moment for us to capture that information, to analyze it, and then to share it back with the public, with policymakers, with advocates, so that we can do the right thing, so that we can maybe try to prevent COVID-19 outbreaks across the country. And as we both know, unfortunately, we collected that data, but little was done to stop the massive impact that this pandemic is having on people who are incarcerated across America.
Lauren, I have been talking about what's going on behind the walls uh, with COVID-19 in several previous episodes. One of the things that I notice is that the rate of infection is spreading in the prison populations 5 times faster than the rate that is spreading in the American population. Also, that the rate of deaths related to the infection is 3 times greater than the rate affecting the American population. There seems to be a silence on that. Can you talk about why that is?
That's a great question. So, yeah, as of today, we know that 24% of the American prison population has had COVID. The death rate, the case rate far outpace the general population numbers, and yet we've seen very little action. And I think it's because this is a population that is devalued, that's been marginalized by society, also been marginalized by the field of public health. I think for a long time, people have convinced themselves that what happens in jails and prisons is completely outside of what happens to the rest of us in the community, that there's no connection between people who are incarcerated and the community. And that's clearly wrong, and clearly wrong in the context of this pandemic. I think people have convinced themselves that people who are incarcerated don't deserve public health intervention, don't deserve certain rights. I've watched your show before. Prisons have moved to rural locations. There's an intentional disconnect between the community and incarcerated people. And I think because prisons are out of sight, they've been out of mind. And I think that's why we haven't seen as much action. I will say that in this moment, we're seeing more attention than ever from the public media, from some policy makers on what's happening in prisons. And our intent is really to continue to open that door so that people see that there is this clear connection. Most people who are incarcerated come out, staff move in and out. And so what's happening in these settings has an impact on people who are incarcerated and also the rest of society.
Okay, this is a lot. I think there's a public relations campaign going on. Half the states in America have stated that they would treat the elderly prisoners, give them the vaccine at the earliest possible time. What is actually happening to prisoners? Are they really being released? Early on, it seemed that prisoners were being released, but now it seems like there's no movement on that front.
Mhm. Yeah, it's a great question. So no, people are not being released at the volume that we think is the right number. Very early on in the pandemic, we saw that jails reduced their population by about 30%, prisons by about 5%. But in more recent months, we've seen that that number has gone right back up to what it was before the pandemic. And in the case of the prisons, we think that much of the decrease in population was actually because there weren't people being admitted from local jails. And so I think there was very little reduction in population release of people, which, as you know, is a very important mitigation strategy due to overcrowding and inability to engage in social distancing. So I think we have a long way to go on decarceration and the movement toward decarcerating the states. In related to the vaccine, when we first looked at vaccine plans, we saw that the interim plans that were turned into the CDC, only about 6 states had some proportion of the incarcerated population in their phase one. We saw some movement between the time they turned in their interim plans and their final plans to the CDC, and even from then until now. We've got about half the states that have said that they have some intention to vaccinate some people who are incarcerated. But I think in our opinion, there's not enough movement in that front. We've seen about 13 or 14 states begin vaccination among people who are incarcerated, but it's a very small proportion of people, usually people who are very sick or very old. And I think there's justification for large scale deployment of vaccines across the entire prison population very early in our phase one.
Okay, let me follow up on that. Why do you feel there's a need for immediate vaccination for prisoners when prisoners are tucked behind the walls of the prison industrial complex uh, and safely away from the general population? Uh, how will this impact the general society?
Yeah, it's a great question. So I think there are two main reasons to prioritize this population. The main aim of the vaccine is to reduce severity of disease and death. If we look at the epidemiology of COVID-19, we can't ignore the fact that prisons and jails have been the epicenter. And so if we need to deploy our strategies to the population that is the most impacted, it has to be for prison and jail populations. And then the other, which gets more directly at your point, is that there is this connection between what is happening inside of prisons and jails and what's happening in the community. So staff live in neighborhoods surrounding prisons and jails. They go to work inside of those prisons and jails. They may be exposed in their community and bring that to the prison or jail. They may be exposed in the prison or jail and bring that to their community. People are released from jail. 11 million people in this country are released from jails every single year. Many people are released from prisons every single year, and they go back home to the communities that they live in. And so there is this very clear pathway between what is happening inside of prisons and jails and what's happening in the neighborhoods that surround these carceral settings. And so if we deploy large scale vaccine rollout in prisons and jails, it protects the people in those settings and it also protects the surrounding community.
Okay, so I don't know if you have been following the spread of the disease in relationship to transfer of prisoners from one prison to another. But for example, in California, hundreds of prisoners were transferred from a Southern California prison up to San Quentin, which had virtually no infections at that point. All of a sudden, the infection rate in San Quentin skyrocket. Uh, in Ohio, a similar situation occurred in which hundreds of prisoners were transferred from infected prisoners, that is, was transferred from one prison to another. The other prison didn't have infections at any considerable rate, and all of a sudden their cases skyrocketed. Here in Maryland, say for instance, uh, the prison system has been locked down since maybe March. Uh, in the Jessup region, there was in the low numbers, like 10 or 15 cases of infections. All of a sudden, in November, prison officials decided to have a massive shakedown of the prisoners, their cells, pulled them all out of their cells, frisked them, shook them down, made contacts, uh, put them up against walls, etc. And all of a sudden, from November to now, the cases have skyrocketed in the Jessup facility. Uh, Similar cases like this have been going on across the country, and it seems that prison officials are orchestrating the transfer of infected prisoners to other prisons that's not infected. Uh, is this deliberate? I mean, what do you think is going on?
Yeah. Yeah, so our group has been watching it. One thing that we're trying to capture is the policy decisions that have been made relevant to COVID. And so we're looking at policy decisions around transferring, around closing of certain prisons, and transferring people in mass from one prison facility to the next. What you're saying has happened across the country. There have been many systems who have, with little rationale, moved large numbers of people from one facility to another, and we can watch the transmission of COVID happen as that transfer decision is made. One of the large scale policy decisions that have been made is to completely shut down visitation. And the logic behind that decision is so that people on the outside don't bring in COVID into, behind the bars. The same rationale could be applied to the transfer of people. And so there's incongruence between, allowing transfers but not allowing visitation. So movement of people, especially when you don't have mitigation strategies in place, when you don't have mask mandates, when you've got correctional officers that refuse to wear masks, when you don't have testing on board, movement of people should absolutely not be happening, because we've seen the devastation that has been a result of large scale movement.
Okay, so the COVID prison project give us up to date data on what's going on from state to state, uh, and so we can see the trend. Is there any enforcement activity that can happen to stop these transfers and the spread of this infections behind the walls?
Well, I hope so. We have been working with Senator Elizabeth Warren to create some legislation around testing initiatives and also data transparency. Of course, what happens at the federal level doesn't have broad applicability to the states, but often what happens at the federal level sets a precedent for what states can do. I think one of the bills that we've worked with her group on is this data transparency bill, which requires a certain amount of data be reported to the CDC, to legislators, and to the public in regular intervals so that we can illuminate case numbers, mortality numbers, testing numbers, et cetera, so that we can constantly know what's happening so that we can intervene as needed. And then the other bill we've been working on together is related to routine testing. So making sure that both staff and people who are incarcerated have access to a test, have access to treatment when it's needed, have access to medical isolation or quarantine settings that don't mimic solitary confinement. And so we're working on some legislation which we hope will be impactful.
You mentioned the federal prison system setting the standards for the rest of the states in terms of how they treat prisoners. To date, the federal prison system have decided to vaccinate all the correctional officers, but none of the prisoners. Is this an executive decision, and can it be changed by an executive order?
Unfortunately, the Advisory Committee on Immunization Practices, which sets the standard for the CDC and works with the states to set the priorities for the vaccine, they are the ones that made that decision to prioritize staff and to not prioritize people who are incarcerated. And we think it was the wrong move. Much of the justification for why staff should be prioritized certainly applies to people who are incarcerated. And so we had hoped that they would change that recommendation, which would then trickle down to the states, but unfortunately they did not. I think when you have a situation where you're prioritizing staff over people who are incarcerated, it furthers medical distrust that's very warranted and justified based on years of experimentation and unethical practices among prisoners. And I think this just helps to further that distrust, which may make people less likely to take the vaccine at all. And so I think it definitely is not something that much of the public health professionals that work in this field would have recommended.
As I'm watching these cases behind the walls, uh, it reminds me that germs have been used in America's history to eradicate populations. The indigenous population comes to mind right away. You earlier mentioned Tuskegee, the syphilis experiments. Uh, there's been a number of other experiments throughout the 70s in which chemical drug companies have used prisoners to test their products. Uh, there seemed to be a case here where there's deliberate targeting of certain populations. In the prison industrial complex, uh, people of color make up almost 75% of the population. Uh, and people in poverty might make up uh, 80 or 90% of the population in the prison complex. And for this pandemic to be spreading rapidly throughout those populations seem to make a case of possible genocide.
Mm. I mean, it's such a deeply, um, I mean, so I can't answer that question. Are there prison and jail facilities where little has been done to control COVID-19 with the full understanding of the devastation that will be wreaked when left uncontrolled? That certainly could be the case. And I think that, undergirding your question is in part the framework that this country has had, that has thrown away people who are incarcerated, that has built the carceral system as we know it on a system of slavery that transformed itself into a system of Jim Crow that transformed itself into our current paradigm. And so the question is valid. I think what I have to do, what our group is trying to do, is to shine light on the fact that no one has cared about this population, that we should care now, and that we have to have drastic change. We have to recognize the humanity of people who are incarcerated. We have to give them a seat at the table when we're designing public health or otherwise interventions, because they're the experts. They know how it works. And our main aim here must be, we need vaccines on board, we need testing on board, we need safe conditions. But I think our main aim must be decarceration. So many people in this country are in prisons and jails. They do not they should not be there. We have oriented to a system of public safety that is oriented to punitiveness. And I think this is an opportunity for us to have data to shine a light on how the system has always been, but now people are paying attention. So we have to open that door more fully, to say maybe we should reconsider all of it. And I think that's what we're trying to do with the COVID Prison Project.
Okay, so is there anything the public can do to help address the situation behind the walls?
Yeah, I mean, I think you should call your legislators. You should make them know that it's wrong to not prioritize this population's these settings. You can talk to your friends about it. And I think, the other thing you can do in the context of COVID and outside is really advocate for people who have been incarcerated and who are are currently incarcerated to really be the experts of their own experience to help us get out of the situation that we're in. And I think maybe just have hope that there is a different, some difference on the horizon.
Are there any final thoughts that you would like to share?
I guess the final thing I'll say is that, we spend a lot of time trying to change the position of Department of Corrections of jails, which is really important. But I think the other thing to also keep in mind is that the public health, the public health profession has also ignored this population. It's on them to also advocate for people who are incarcerated to form relationships with departments of correction, so that vaccines can get on board, so that testing can be in place, and so that we can begin to think about public health alternatives to incarceration.
Okay, thank you for joining me, Dr. Lauren Brinkley-Rubenstein.
It's my pleasure. Thanks so much.
And thank you for joining this episode of Rattling the Bars.